So quickly looking at another concept in as related to child's delivery, that's birth. We're looking at what is known as the epidural anesthesia. Alright. So epidural anesthesia is just simple. It's an anesthesia that they will give in this region of your spinal cord. So you might want to ask, why at this region of the spinal cord? Of course, there are a lot of nerves here that are linked to the pelvis. So there might be various reasons why we are giving this, why we'll actually look at it. So this is where they give it. Okay. So epidural anesthesia is a widely used technique, just to relieve pain. So if the mother is in labor, trying to deliver a baby, and the pain is unbearable, so you don't want to lose the mother, as well as sometimes they can still use epidural. It's not only for labor, right? So they can also use it for any surgery that is in the lower part of the body, from the pelvis and perineum. So a lot of nerves that innervate the pelvis and perineum come out through this side, the L1 to the sacral nerves. So it works by blocking the nerve signals from the lower spinal segment, resulting in a loss of sensation. So they are doing things in your lower body and you can't even feel it because they have blocked it. So how does it work? Medication is injected into the epidural space. This is the area surrounding the spinal cord and its protective membranes. A catheter is often inserted to allow continuous or intermittent delivery of the anesthetics. So common drugs that can be used is things like bupivacaine, lidocaine. Those drugs, we'll talk about them in pharmacology. Okay. But if you want to know how these drugs work, you can just comment. Alright. So opioids like fentanyl, just to enhance pain relief with minimal motor block. So procedural overview is the patient is positioned, is usually sitting. You see this one is sitting. Okay. Or the baby can lie on the side, just lying on the side like that. So the lower back is cleaned, then you numb with a local anesthesia. A needle is inserted into the epidural space. A catheter is threaded through it. Okay. So can I say this is the took line. So this is actually the needle. When you put the needle, you put the catheter. This is the catheter. They deliver the anesthesia. Okay. So the needle is now removed, leaving the catheter in place for ongoing medication delivery. So if you want to deliver any other medication, you can still be using the catheter. So onset and duration is, once you give it, it takes at least 10 to 20 minutes for it to start working. Duration depends on the medication and whether a continuous infusion is used. A single injection may last a few hours, while a catheter can provide relief for much longer. Benefits is, usually relieves the pain during labor, without complete loss of consciousness. We can adjust the doses and all of that. Okay. So risks and side effects, you can have a drop in blood pressure, headaches, you can have itching, nausea, difficulties urinating. So that's just it for the epidural anesthesia.